Statistics from UNICEF says that of the over 7 million babies that are born annually in Nigeria, about 56,000 will be born with any of the congenital heart diseases, with the most prevalent being the ventricular septal defect, commonly known as hole in the heart. Statistics also show that there is a continued rise in the number of young adults and elderly people suffering from acquired heart diseases. Of the billions of naira that leaves Nigeria in medical tourism, heart-related surgeries account for a major chunk of that sum. Why? Nigeria has less than 50 cardiothoracic surgeons. Less than 50 cardiothoracic surgeons to over 200 million people. This is by far the most heartbreaking calculation you would do, pun intended. Our guest today is Dr. Alioke Ikechukwuka, a cardiothoracic surgeon at the Federal Medical Center, Jabi, Abuja, and we're going to be discussing the challenges of cardiothoracic surgery in Nigeria. My name is Ekwe Onyekwele. This is the White Coat Report. Thank you for joining the conversation. We'll be right back. Welcome back. This is still the White Coat Report, and if you're just joining us, then you're in luck. We're just about to kick off our discussion with Dr. Alioke on the challenges of cardiothoracic surgery in Nigeria. So right off the bat, Dr. Alioke.
Thank you very much for the opportunity to engage you in this discussion concerning the challenges of cardiothoracic surgical practice in Nigeria. I will just give you my own perspective of the challenges as I get to practice as a cardiothoracic surgeon here in Nigeria. Well, as you already alluded to, we are quite few, probably the fewest major subspecialty in surgery.
How many
in Nigeria? Well, we are less than 50, as you said, practicing in the country.
How about a particular figure?
Well, I may not be able to offer a particular figure at the moment, but I just know that we are less than 50 or thereabout that are currently practicing.
Registered?
Yes, registered in the country, because quite a number of us are already practicing out of the country. So we're talking about those that are in the country, we are quite less than 50 or thereabout. And you will agree with me that with respect to the burden of cardiothoracic and vascular surgical practice or need in the country, that number is grossly inadequate. So, but in our various areas of practice, we do our best to see that we meet up with the demand on ground. The major challenge
before we get to the major challenge, I would like to know why you chose cardiothoracic surgery. I mean, with the few numbers, it means it'll have to be really, really special, something special that made you go into it. So what happened?
Yeah, I chose cardiothoracic surgical practice. I think it's just out of interest. God has created people with different interests, and I, for one, I prefer areas where people are few, areas where the challenge seemed much. And when I was a medical student, I got to understand that cardiac surgical practice was not that rampant in the country. And it was quite, I say just a handful of centers were doing it on and off. So I felt that I could come into this field of study, this field of practice, and make a difference in my own little way in the practice of cardiothoracic surgery. So I think it's just basically choice and the fact that I felt I could make a difference.
You had the mental capacity, because I heard you would have to be really smart to do cardiothoracic surgery or neurosurgery.
Well, I think,
so is that true?
Well, that may not really be true, as people say. The fact that one is operating on the heart, on the chest, and the brain does not mean you are the smartest. I think being a doctor makes you smart. Even anyone who has gone through the four walls of a university is smart enough. That's why the person, got certified as a graduate. So I think it's not really about being smart. It's just about being focused, being willing to learn, because anyone can be trained. Anyone, even if you have a dog today, if you repeat something often, the dog gets trained in that in that aspect. So I think it's just all about the dedication, willingness to learn, and willingness not to make as much mistakes that will cost the patient his life. So it's not really about being smart, just dedication to the practice.
Yeah, so what do you think actually discourages medical officers to specialize in?
Yes, I think this question has been asked quite often amongst my colleagues. I think the major discouragement is the fact that as it stands in the country currently, there is no center with the full accreditation in Nigeria to train cardiothoracic surgeons.
No center at all?
No center at all, as it stands today in Nigeria. Possibly before the end of the year, maybe some 1 or 2 centers will be fully accredited. Now, the reason for that is that you have to, for a center to have full accreditation, that center has to be doing regular open heart surgeries. And by that, you will agree with me that quite a number, very few centers are meeting up to that demand. Quite some centers like maybe Lagos State University Teaching Hospital, Tri-State Cardiovascular Center under Babcock Teaching Hospital, University of, Obafemi Awolowo University Teaching Hospital, Ife. These are the ones doing regular open heart surgeries. Then quite some other institutions like Reddington Hospital, even here in Abuja, Turkish Hospital, they do once in a while. These are private facilities. Even Abuja Teaching Hospital in Abeokuta, I think. Doing then, I think UNTH, Itukozala, Enugu, they do also once in a while. So you need
but that is still not enough
for the
population, because we still have Nigerians traveling to India.
Yes. So the first challenge is that we don't have a center that has a full accreditation. So when you have a resident that has to go abroad to spend at least 1 year for cardiac surgery training, because that is compulsory based on the curriculum, 1 year and above, maybe 1 year, 1.5 years, depending on the college, the West African College or the National Postgraduate Medical College. If you have a resident that has to sponsor himself to go abroad, all he has to depend on is probably his salary from the government, or maybe nowadays they have started this residency training fund, which cuts across board. So while other residents are using their own funds to buy their materials, pay for exams, this cardiothoracic resident will use that same money to go abroad and still come back and depend on his salary to pay for his exams and his update courses. So when you see the costs,
do you think this affects
yes, this affects
the number of people,
interests.
Yes.
It affects the interest of residents going into cardiothoracic surgery, because if I have to spend so much and travel abroad and stay away from your family to go and get trained, then I would probably, if I'm not that interested in cardiothoracic surgery, I'll just look for another easier alternative. So I think that is the number one turn-off for residents going into cardiothoracic surgery.
So if there can be a government policy that somehow rewards more resident doctors in cardiothorax.
Yes, or a government policy that fully sponsors overseas training.
Overseas training, yes.
Yes, if there is a full sponsorship for overseas training, perhaps residents will be interested in doing cardiothoracic surgery.
Yeah. Could you run us through your education, your training? Quick one.
I had my basic medical, training, MBBS, Bachelor of Medicine, Bachelor of Surgery from Ahmadu Bello University, Zaria. I did my internship 1 year in Ahmadu Bello University Teaching Hospital, Zaria. Then I went for my NYSC at Osun State. I worked at Comprehensive Health Center, Iresi. Then I came back, I started my residency in Ahmadu Bello University Teaching Hospital, where I had been from 2012 till 2020. So I left there in 2020 when I completed my residency in both colleges, and then moved over to Federal Medical Center, Abuja. During the training, I actually spent some time out of the country. I spent about 6 years in Zaria, then 1 year in Ghana, 1 year in India, and also within the country I spent some 4 months in University of Calabar Teaching Hospital, 3 months in University of Nigeria Teaching Hospital in Enugu. So just by and
total
large, total of 8 years.
8 years.
Yeah.
So do you think this number of years also affects the interest?
Oh yes, it affects it, because if I have other subspecialties in medicine where I can spend 4 or 5 years, if I'm not too interested in cardiothoracic, if I don't have a strong leading to go into cardiothoracic surgery, why would I want to spend 8 years and stand the risk of being rusticated from the training program? Because the training program is time bound. If you get to a certain period of years, you'll be sent out of the system so that they can admit newer residents. So these are all the factors that play a role. Now,
can you learn all you need to learn in a lesser amount of time, or is the 8 years absolutely necessary?
I believe the colleges that have placed the curriculum at 8 years have placed it because that is the optimal time needed to get the basic training. That doesn't mean that at the end of the 8 years you you have acquired all you need. Training is a continuous process. There might be some aspects of cardiothoracic practice that I might need to go to some other center to go and acquire more skills, or a refresher course, for me to practice optimally.
All right. Let's just take a quick break. We'll be right back. Welcome back, and if you're just joining us, we've been talking to Dr. Alioke Ikechukwuka on the challenges of cardiothoracic surgery in Nigeria, from the number of years it takes to qualify as a thoracic surgeon to funding for the residency program. You're welcome, stay tuned. So Dr. Alioke, before we went on the break, we're talking about the number of years and also the funding for residency program. But now that you're fully qualified, how many years have you practiced now as a cardiothoracic surgeon?
Okay, well, thank you very much. I'm a young cardiothoracic surgeon. I will use the word young, not with respect to age, but with respect to years of practice.
Yeah, even with age too.
As a cardiothoracic surgeon.
You look quite young too, with respect to age.
Yeah, so I qualified last year. So I'm just within my first year of practice as a cardiothoracic surgeon.
How has it been so far?
Well, it has been interesting. It has been interesting in the sense that I know that I am responsible for patients as a consultant. Formerly, as a resident, I had a consultant to fall back on. Whenever I had a challenge, I could always fall back on a consultant. But now, as a consultant, I now know that I am responsible and the bulk stops at my table. So the decisions I take will make or mar a patient. So the
pressure,
the challenge.
More pressure right now.
More pressure, but I think the pressure eases off as the practice goes. The pressure was higher up when I started my practice as a specialist, but as the time went by, I got used to the drills, and nobody is a monopoly of knowledge. One learns every day, and once you stay in the midst of good counsel, you are not likely to make mistakes. So I still consult my teachers whenever I have a challenge. Just tell them, okay, I have so patient with this and that. Okay, what do you think? Let's just get to know their opinions. That way, you grow. You stand upon. You stand upon the shoulders of the elders, and you don't have to make the mistakes that the elders have made. Because in this age and time of litigation, I think the legal luminaries have very low threshold for litigation. So as much as possible, you try not to repeat the mistakes of your forefathers who had gone ahead of you. So once you are in the midst of counsel, even as I'm a Christian, the Bible says in the multitude of counsel there is safety. So once you're in the multitude of counsel, you are likely to be safe. And then you remain humble, learn from everyone in the workspace, even the general surgeons that are experienced in my center. You learn from them, you work with them, they can always help you out.
Speaking of elders and senior colleagues, how many cardiothoracic surgeons in Abuja?
Well, in Abuja, I will say there are 3 cardiothoracic surgeons The first was Dr. Adamu. Three cardiothoracic surgeons. The first is supposed to be Dr. Adamu, or is Dr. Adamu, but he's currently the MD of Federal Medical Center, Kefi. So he's out of town, but he still has his appointment with the National Hospital. And then the next is Dr. Ndubisi Anumenechi, my senior colleague in the National Hospital.
So we have just 2 cardiothoracic surgeons?
Well, practically 2 cardiothoracic
in
surgeons
Abuja.
In Abuja.
Do the mathematics, people. Do the mathematics. And then with the population, what's the population of Abuja? And then just 2 thoracic surgeons.
Well, it's grossly inadequate.
Wow. How do you do it?
Agree. Well,
if both of you are not in town, what happens?
Well, I think so far it has not happened that both of us are not in town. If for whatever reason I have to leave town, I think I will have to alert him, let him just know.
And vice versa?
Yes, and vice versa. Because if there is a serious dire emergency, this is Abuja, the capital, the seat of power, it could be the president and there will be no time to fly out. It could be anybody. So at least somebody has to be on ground. I mean, should in case there is an emergency.
Okay.
As much as possible.
That has a lot of pressure on you. I hope you will be able to, carry that pressure. Yes. So let's talk about cardiovascular surgeries in Nigeria. What is the most complex surgical procedure right now that Nigerian cardiothoracic surgeons can actually do?
Well, you see, complex cardiac surgeries.
Open heart surgery. I think that should be the most complex, right?
Well, you already said cardiac surgery. Okay, yes, okay.
Let's
take it open heart, because some cardiac surgeries are not open heart.
Okay.
Some cardiac surgeries are outside the heart. You don't need to open the heart.
So non-invasive.
Yes, well, it's all, once you're opening the body is invasive, but at least you are not opening the heart.
Okay.
Because once you have to open the heart, then the patient has to be on what we call cardiopulmonary bypass. So there is a machine that takes over the function of the heart and the lungs. So
I don't want us to go into that right now. What I'm just trying to say is, can Nigerians be confident that they can get any surgical procedure they need for their hearts in Nigeria without having to travel to India or wherever else?
Yes, all you need to do is just get in touch with a cardiothoracic surgeon and he will link you up with the centers that do those procedures in the country. We know ourselves, we know people, cardiac surgeons in Nigeria that are specialized in certain aspects of open heart surgery. So if we interact with a patient, even if we can't offer it in our own primary center, we can refer the patient appropriately to the centers that will carry out such surgeries. But by and large, there is hardly any complex case that would require you to fly out of the country that cannot be arranged to be done within the country as it stands today.
Have you been privileged to be part of an open heart surgery session?
Oh yes, you cannot train as a cardiothoracic surgeon and not be part of it. That's part of the training, and that's why we had to go abroad. I told you I spent 2 years abroad. 1 year in Ghana, 1 year in India. The 1 year I spent in India was the most productive for me because there I was privileged to do cases independent of my boss. My boss would not need to come in. All I just do is I just give him feedback. And some simple cases that are actually open heart surgery. So talking about if I was privileged, every cardiothoracic surgeon is privileged to participate in open heart surgery. Okay. And I've also participated even in the country. At least while I was at UNTH Enugu, I participated in the open heart surgery sessions that we had at that time in 2019. So it's a rampant thing. It's no more something that's out of the blues.
Oh, wonderful. It's interesting to hear. I asked because we have Nigerians traveling. Like I said, when we talk about medical tourism, the amount of money Nigeria loses to medical tourism, majority of it comes from heart-related surgeries because Nigerians always tend to travel out for heart-related surgeries. And then let's talk about hole in the heart. Yes, well, would we say, because we have so many, I read an article and it said that so many cases go undiagnosed until the person is even older. So why is that so in Nigeria? And then also the mortality due to hole in the heart is also very high. Is it because we do not have enough number of cardiothoracic surgeons to handle cases, or is it that we do not have enough diagnosis for it? We're talking about the echocardiogram or whatever that is used for it, or is it because patients can afford to pay for these procedures? Which one is it?
Okay, well, I think it's all of what you have said.
Oh, okay.
All of what you have said. I will just highlight a little on each of them. For cardiac surgeries, first of all, one needs to have a good diagnostic setup. to be able to diagnose that this patient actually has a hole in the heart, as you say. Even though we don't commonly call it hole in the heart in the profession.
Yeah, VSD.
Each of them have their names. It could be a VSD, a ventricular septal defect, ASD, different things. But generally, well, for the sake of this program, we can just stay
hole in the heart, the common man.
In the heart.
Hole in the heart.
Okay.
Yes.
Yeah, so one should be able to make a quick diagnosis and an accurate diagnosis. Now, if a child comes and is coughing, maybe having difficulty with breathing, all people just do is, okay, just give them a cough syrup. First of all, the child may not present to a hospital. They might just end up at just the primary health care facility, and they just give cough syrup, antibiotics, or they may not even see a doctor. Perhaps if they had seen a doctor would have examined appropriately, listened to the heart, and found some of those things that will be a pointer to a hole in the heart, and refer them appropriately for echocardiography to make appropriate diagnosis. So our healthcare, I think, is the same challenge going on in every other aspect of our healthcare in the country. Another problem, or another major challenge is, even when the diagnosis is made, these patients cannot fund for open heart surgeries out of pocket. So that is where a strengthened national health insurance scheme comes into play. If we have a strengthened national health insurance scheme, patient does not need to pay for the evaluation, making of the diagnosis. He does not need to pay for the surgery. He does not need to pay for follow-up and other management plans that may need to be instituted for such a patient. Now, if one has to pay out of pocket, imagine a patient paying 7 million, let me say 5 million, 3 million out of pocket at little or no notice. That is difficult for most Nigerians.
And in a country as poor as Nigeria.
Well, as poor as they have made us to believe. I don't want to go into the political aspect of that, because Nigeria is a blessed country.
Yes.
Yeah. And then also talking about the facilities on ground. For open heart surgery to hold in most institutions, every other aspect of the hospital has to be working to an optimal level. Now, by this I mean, for you to have open heart surgery is the field in surgery that requires a major machine to carry out. One can do neurosurgery, not to belittle neurosurgery or general surgery or urological surgery, but one can do some of those surgeries without requiring a machine to take over the function of that part of the body. But for open heart surgery, getting the heart-lung machine is a major investment. It runs into millions. A new heart-lung machine is about $180,000. It's not what
in naira. That's like how much?
Well, I don't know what the exchange rate is now, because it keeps fluctuating. So that's that's quite expensive. You also need an optimal intensive care unit to be working functionally. You also need a blood bank to be able to give you blood products, like different aspects of blood. So it's not just a whole blood. You need a CT scan machine to be working optimally, MRI. You also need a standard echocardiography suit, you understand, to be able to make this diagnosis. So you see that for open heart surgery to be successful in any center, you need every other aspect of the hospital to be working perfectly before you can now talk of setting up open heart surgery. So even if you want to set up open heart surgery, look into other aspects. These are the supporting departments that will make open heart surgery successful, because otherwise, yes, one can just go into the heart, come out, but can the patient be managed well in the ICU? Do we have adequately trained cardiac intensivists to manage these patients post-operatively? So these are all the factors that now make it look as if it is difficult for our teaching hospitals, our government-run facilities to commence and sustain regular open heart surgery. So the funding is part of it, equipping of our hospitals, the diagnostics is part of it, and then even for the centers that are doing it regularly now, is there awareness, adequate awareness? Quite a number of doctors in the country still don't know that there are centers that do regular
doctors now.
Oh yes, doctors.
Not to talk of the citizens.
Yes, not to even talk of citizens. So we need that awareness. But the only advice I will make is this: whenever any patient is diagnosed to have a cardiac condition that requires surgery, endeavor to see a cardiothoracic surgeon, because it's only a cardiothoracic.
But when you have just two in Abuja, how long would it take you to see one?
Well, it doesn't take long. Just get referred to Federal Medical Center Abuja or get referred to National Hospital Abuja.
Okay.
And you see a cardiothoracic surgeon. It's easy. So, and then the cardiothoracic surgeon will now enlighten you on how to get these services done.
All right. You know, there's this general impression in Nigeria amongst the public, the general public. I think they see most of the cardiothoracic surgeons and even the neurosurgeons in Nigeria as middlemen. When I say middlemen, I mean you guys just take care of them pre the procedure for when they will get to travel out, stabilize them, and then they travel out, they have the procedure done, come back, and then you just take care of them while they then visit their doctors abroad once in a year or twice in a year. So well, what do you have to say to that? Do you agree or do you disagree?
I completely disagree.
Okay.
Not at this stage. I mean, anybody traveling out of the country, as it stands today, you use the examples of neurosurgery, surgery. Let's start with neurosurgery. Anybody traveling out of the country for neurosurgery in Nigeria just wishes to travel out.
Okay.
Because I'm not in neurosurgery, but I think most of the problems that that a patient would need intervention for neurosurgery can be offered within the country. Now, same thing goes for cardiothoracic surgery. Whoever wishes to travel out is just traveling out of wish. Perhaps he feels, okay, let me go to a center where they have high volumes and they do it more regularly. The success rate in the country, yes, it's fair. It's comparable to some
international standards.
Yes, at least quite comparable to international standards to some extent. So it's not like we are not middlemen. Okay, using my own practice as an example. Here in Federal Medical Center, Abuja, well, I'm not supposed to be saying this in this forum until it kicks off.
Okay.
Under the leadership of the current MD, Professor Saad Ahmed, he has demonstrated the willingness to commence regular open heart surgery. And he's doing his best to get us the necessary facilities.
So that means going to put all those things you talked about in place.
Yes, all those things. All those things are already in place.
Okay.
All the supports. We have a standard ICU.
How many beds?
We currently have a 5-bedded ICU that's functional and a 10-bedded ICU that will soon be commissioned.
Amazing.
That's a federal government project, I think, in several other teaching hospitals. I mean, if you come to the ICU, I'm not helping to sell.
Okay.
Anything you have internationally, you have in the ICU at Federal Medical Center Abuja. You'll be amazed at the services and the quality of the trained staff that we have there.
Amazing.
At the ICU at Federal Medical Center. So now the heart-lung machine we are talking about, yes, it's in process to obtain it, and hopefully by next year, the regular open heart surgery will commence here at Federal Medical Center. So thanks to
Professor Saad.
Yes, because he requires the diligence and the dedication, the determination of the leadership to get it to work.
Okay, all right. What have been your challenges so far? Your expectation versus reality, that's what I call this question. What you're expecting while you were training and what you're now seeing while practicing.
Well, I would say having to come to Federal Medical Center Abuja, because that's the only place I have worked in as a specialist. I have not been disappointed so far. So perhaps I will not be in the best of position to give you an answer with respect to what have been my challenges, because I'm not saying it's a perfect place, but I've not really faced any major challenge that has not been surmountable so far. Apart from the fact that initially I was a little bit quite excited, quite agitated, knowing that the management of patients who have cardiothoracic complaints ends at my table. But besides that, I think I've gotten used to it as a new consultant in that place. I've gotten used to it, and I've learned how to cope, especially with the workload.
No,
so
that's amazing. That's amazing. All right. So I'm going to ask you our final signature question. All right. If today you're made the Minister of Health, what is that one thing? You know, there are so many challenges in the health sector, but if you're made the Minister of Health today, what is that one thing you will do that will have a positive ripple effect on the various challenges in the health sector?
Yes, thank you very much. We keep on talking about funding. I know the National Health Insurance Scheme is under the Ministry of Health. For the aspect of funding, I may not talk much about that because that doesn't lie in the purview of the minister. It's a presidential issue, an executive issue. But if I were the Minister of Health, one area of focus on is funding for the National Health Insurance Scheme. The National Health Insurance Scheme has to be strengthened people have to participate. The percentage participation and contribution to National Health Insurance Scheme is so low.
So less than 5%.
People, yes, far less than that. Yeah, possibly. I don't have the statistics.
Yeah.
So National Health Insurance Scheme has to be well organized, because if people have to pay out of pocket, procedures will not be done, cancer care will not be done appropriately, and the skills of these surgeons or the physicians will not increase, because we need the numbers. If I'm a cardiothoracic surgeon and all I do is I do open heart surgery, just 3 in a month, you can't compare the level of my skill or with someone who is in India who does that same 3 in a week, or maybe 5 or 7 in a week. He encounters more challenges, encounters more mistakes, he gets faster, and of course, the more you do, the cheaper the cost of the operations will get, because those who supply the consumables you need, it's a question of numbers. The more you patronize them, the cheaper things get. So, the one thing, as you asked me, is that NHIS, National Health Insurance Scheme, has to be strengthened one way or the other. Yes.
Thank you so much. Thank you so much, Dr. Alioke Ikechukwuka. I got it right this time around.
Yes,
it's been amazing having you. It's been eye-opening, enlightening, and I hope you guys have learned a lot when it comes to cardiothoracic surgery in Nigeria. I want to say one thing. I actually ran into a young man yesterday, and then he was complaining and going on and on about his friend who had a road accident, and sustained major head and spinal cord injuries. And then he was complaining about the length of time it took the neurosurgeon to actually see his friend. And then I asked him, do you know how many neurosurgeons we have in Nigeria? And he said no. And I said, we have way less than 100. And then he was amazed. Then I said, hold on, do you know how many cardiothoracic surgeons we have in Nigeria? He said no, of course. And I'm like, way less than 50. What I'm trying to say is the attention on Nigeria's health sector is way too low. I think the general public talks about the health sector only when the health workers go on strike, and individually when they experience the health system and they are disappointed, or when they become victims of the health system. But for there to be a change in the health sector, the attention has to be daily. There has to be a public outcry on the changes needed in Nigeria's health system, and that is when everybody is going to get to enjoy the system. Thank you for listening to my rant, and that marks the end of the show for today. Thank you.